medical channel. Ulcerative colitis, a chronic inflammatory bowel disease, often presents with periods of remission, followed by painful relapses. Traditionally, management has focused on medications to maintain remission and control flare-ups. However, recent research suggests a surgical procedure might offer significant benefits. A randomized superiority trial, known as the ACCURE study, investigated the impact of appendectomy on relapse rates in ulcerative colitis patients. Conducted between September 2012 and September 2022, the study involved 197 patients in remission, but with a history of active disease in the previous year. Participants were randomly assigned to two groups. One underwent laparoscopic appendectomy in addition to standard medical therapy, while the other received only standard medical therapy. The findings were compelling. After 1 year, 36% of patients in the appendectomy group experienced a relapse, compared to 56% in the control group. This represents a 35% relative reduction in relapse risk for those who had their appendix removed. Moreover, fewer patients in the appendectomy group required escalation to biological therapies, indicating a potential for reduced medication dependency. Adverse events were comparable between both groups, with no deaths reported. Interestingly, 2 cases of low-grade appendiceal mucinous neoplasm were incidentally discovered in the appendectomy group, highlighting an additional benefit of the procedure in identifying asymptomatic conditions. These results suggest that appendectomy, a relatively low-risk surgical procedure, could be a valuable addition to the treatment arsenal for ulcerative colitis, particularly for patients struggling with frequent relapses. Further research is warranted, but this study opens the door to new, potentially more effective management strategies for this challenging condition.